There's an African proverb that states, "When I saw him from afar, I thought he was a monster. When he got closer, I thought he was just an animal. When he got closer, I recognized that he was a human. But when we were face to face, I realized that he was my brother." If we can be honest, sometimes there's an equally big gulf between the researchers that study health disparities and the actual communities that are directly impacted by health disparities. Part of my work here as a researcher at the School of Medicine is to create safe spaces for academics and non-academic communities to come together, to have dialogue, combining the wisdom and lived experiences of communities with the tools and the expertise of researchers to co-generate context-specific and comprehensive solutions for addressing health disparities. My professional and personal journey has taken me from monster to brother. And through the lessons I will share with you, I hope this will move us from simply those who do health disparities on communities, but rather do health disparities with communities. So one of the biggest lessons I learned is really treating everyone with dignity. Growing up, my family faced many financial hardships, and there were many times and occasions where I was homeless growing up. In fact, the longest stretch of homelessness was when I was 11 years old in middle school, living in Greenbelt Park in a tent. You know how you feel when you're driving down MLK and you go over an overpass and you see people living in a tent? Well, I know the perspectives of being in a tent and looking out at others when they look down at you. So back to the Proverbs. Perhaps people weren't looking at us as if we were monsters. But living 7 months in a tent, well, I can imagine they at least thought we were animals. Yet in the midst of all these challenges, I was blessed with amazing parents that instilled critical life skills and values that helped me to excel, including persistence and discipline. Whether we were living in a motel, a church basement, or a tent, dinner was always ready at 3:30 p.m. exactly when my dad came home, even if it was rice-a-roni every day. And how my mom managed to do this over a campfire? Now, that's ingenuity at its best. Another lesson is to take time to get to know someone's story. So I've been blessed to have many persons in my life who have helped me to be here today, similar to the stakes that Dr. Jarrell just described as holding up this tent. And one person in particular was my high school math teacher, Mr. Bradford, who was also my softball coach. And he took the time to hear my story. Actually, well, I wasn't a very good softball player. And that meant I spent a lot of time on the bench, so we had a lot of time to talk. I remember one day he asked me, "Londetta, the school year is about to end, you're about to graduate, what are you gonna do?" Well, I looked at him real proudly and I say, "I wanna be a secretary. Not only a secretary, but an executive secretary." And I told him how I had a small job at People's Drug Store and I was saving up money to go to Washington School for Secretaries. And he stops me and he looks at me like I have two heads. And he says, and looks me squarely in the eye, "You're about to be salutatorian. If you don't go to college, then no one in this entire high school should go to college." So his taking time to hear my story, seeing my potential that I didn't know that I had, connecting my hopes with opportunities that I didn't know existed. This led me to guidance counselor who told me about scholarships. And fast forward, I became a first-generation college student, starting with my bachelor's in chemistry at Morgan State University, my PhD in environmental health sciences at Johns Hopkins School of Public Health, 2 postdocs later, one at the National Cancer Institute, another at Georgetown University Lombardi Cancer Center, all the way to landing my first faculty position here at University of Maryland in 2005. I was excited. A basic scientist, now with my very own lab, armed with cell culture mouse models, and really trying to cure breast cancer and stop this disease by identifying genetic and environmental risk factors. Well, one day in 2008, my entire outlook changed. After several years of working in a lab, I was blessed to meet a wonderful woman. She was a breast cancer survivor, and her name was Marlene King. Some of you may know her. She used to work over in the Allied Health Building in the Department of Physical Therapy. Unfortunately, passed away. But she gives me a call one day, and she says, you know, you're the first African-American breast cancer researcher that I ever met, and I want to take you out to lunch. And I looked at her, and I said, you're the first breast cancer survivor that I ever met. Saying that for the first time helped me to realize how oftentimes as basic science, we live in our labs and in silos. And now I recognize I was the one with the distance problem. I used to collect tissues from my mouse model, and they were in test tubes, and I worked with them. But I was also getting tissues from patients in hospitals, and the only way I knew them was the number on the tube. So back to the proverb, was I viewing my cancer patient samples as I did my animals? Well, once I woke, I took time to hear Marlene's story and the wonderful breast cancer survivors from the organization Journey Continues. This was an education that I never got in my years of schooling in the basic sciences. I knew about the molecular and genetic causes of breast cancer, but I didn't know about all the other non-biological factors, like lack of health insurance and transportation to get to the hospital, to get the treatment in the first place, and about the high mortality that African American women suffer and die more than any other race. I was like, whoa, I'm an African American woman. How did I miss this? This prompted me to go back to school after 15 years to get my master's in public health because I wanted to learn more and know about those non-biological factors, the social determinants of health. In this awareness, I started to see everything differently, including my mom's struggles. My mom passed away when I was in my 3rd year of graduate school. And at that time, the cause of her death was not clear. But I knew growing up that she had fibroids. And the fibroids would often cause extended bleeding in her health, and she would lay on the couch, and at times when I would see the white in her hands, I recognized that we didn't have the insurance for the health care she obviously needed. But now, fast forward, when I see journal articles with titles such as Housing as a Vaccine to Prevent Illness, it brings on a whole new meaning. But you know what? When I look back over my life through the good, the bad, the ugly, nothing was wasted. In fact, I now know that they were all working towards the purpose-driven life of where I am now. On the academic side, I feel multilingual. I have the background in basic sciences. I also have the community and population and public health speak. But I also have unique knowledge and a lived experience where I don't have to read about what it means, poverty, or to go through simulated experiences. I've lived through it, and by God's grace, I've survived it. So in closing, how do we close this gulf to reduce the distances, to actually create those authentic community academic partnerships so we can truly see each other as brothers and sisters? I'll leave you with a few practical applications. One, take the time to get to know someone's story. I am privileged to co-direct our program in health equity and population health, and we host a 6-week journal club where we invite persons from the community to talk about the work that they're doing to reduce health disparities. You can also be that bridge to help others find their voice, to connect their hope to opportunities. We have a lot of different pipeline programs here at the University of Maryland, and I want to give a special shout out to my colleagues, Drs. Greg Carey and Dr. Tanya Webb, who within the Cancer Center have helped so many students who, for whatever reason, might not have had the opportunity to pursue STEM. And I believe if we work together, 2 things will happen. We will close this gulf. And you will look at tents under bridges differently. Because as you now realize, inside that tent may very well be an 11-year-old girl who may grow up one day to be your colleague. Thank you.